Well, good afternoon and welcome to the Sleep Well webinar for the month of October. We're proud to present this to you from Health Products for You and shopnebulizer.com. We have for a long time appreciated the need of our customers and patients to have good content and information related to health and wellness, and we're happy to present this webinar each month, focusing in on that topic of sleep, but really it connects to all respiratory issues. So each month we have a nice theme based on Laura Castricone, our resident respiratory therapist, her recommendation as to what's a good talking point for the month. And, Laura, you picked a really interesting topic this month, the presentation that you're going to share for us on children's sleep. We look forward to that in a moment here. Just as a way of reminder, whether you're watching this live or you're watching it on our YouTube channel, we're glad that you could join us. If you have questions after the presentation, we'll have the Q&A session that's open for you to be able to go and ask a question, and Laura will give you the best answer she can. If we can't get a full answer, we'll be sure to follow up. You can always reach us as well. Laura's email is Laura at HPFY.com, Laura at HPFY.com. And that's always a resource if ever you have a question relative to respiratory therapy. Laura's here to help. So Laura, take it away. We're gonna start the presentation for you.
Thank you. Thank you everybody for being here. This is a very interesting topic. I've lectured many times about children and sleep. And for all of us that have had children or have young children, you know, it's a mission to try to get them to sleep to begin with, never mind if they actually have a sleep disorder going on. So what I thought I'd give you today is a little snapshot of what normal sleep should look like and when you should be a little bit concerned about your child's sleep. So it's the topic is what's normal. Excuse me. So here you're going to see a chart that gives you the average amount of hours per day your child should be sleeping at certain ages. So for instance, an infant should be sleeping somewhere between 12 and 15 hours a day. Now, you could have a colicky infant, they could be up more than that, but generally speaking, for a healthy infant, they sleep, and this includes naps, so it's not one straight block of time. So all during the day, they should achieve approximately 12 to 15 hours. And then you'll see toddlers, 1 to 2 year olds, they need between 11 and 14 hours. It's a lot of time, but they're still napping at that age. So you probably can get those hours in. Preschoolers, a little bit tougher because as they start to get a little bit older, they get a little bit more defiant and they don't want to take the naps and they don't want to sleep. So this is the age group and the school age group where we try to get them to get some proper sleep because it starts to affect their performance in school if they don't. And teens are actually a whole subject unto itself. And I might do a whole presentation on teen sleep because they actually present completely differently than both adults and infant, toddlers, and preschoolers. So we'll dive right into it. So when kids get up in the morning, and if your child sleeps a good amount of time, the normal amount of time, they should get up pretty uplifted. They should be a little bit sparky in the morning. Some kids are a little bit overtired, but when should you really worry about how much, if they're getting enough sleep? Well, irritability is a big one, and that's hard to pin down. Why is your child irritable? So you have to figure out, you know, is there something wrong with their clothing? Are they uncomfortable? They have pain? You know, and that's hard to discern sometimes when we have infants and toddlers that aren't able to communicate. So, but watch for irritability that seems abnormal. I've seen kids that have sleep apnea actually be so irritable they can hardly stand themselves. They'll throw themselves on the floor, they'll hide under a table, they act really inappropriately irritable. Excessive sleepiness. If you have a toddler that's asking to go for a nap or is inappropriately falling asleep everywhere, then you can be rest assured that they're probably not getting enough sleep at night. And that's what you have to delve into is why. What's keeping them from not sleeping at night so they're very sleepy during the day? It's kind of a nebulous area because some kids are just more overtired, but generally speaking, they shouldn't be falling asleep at tasks or during times when most children would be awake. Acting out at school or at home and ADHD, I want to skip over and poor school performance. These are all kind of intertwined. We've noticed that before doctors became more educated on children's sleep, they were treating a lot of these these behaviors as if the child had ADHD. And you can imagine what the host of problems that's going to cause, including giving a child a drug, a powerful drug that they may not need. So a lot of times I will say to parents, if they're suspecting there might be a sleep disorder, before you get the child on some sort of medication for ADHD, rule this out, because a lot of times, and I'm going to tell you what the simple fix might be for this. A lot of times their issues are related to not getting enough sleep at night. You know how you feel if you don't, as an adult, if you don't get enough sleep, you are irritable, you're a little bit testy and short, you're sleepy. You usually want to go to bed earlier. Acting out at school or at home, you might act out on your job. You might just be a little bit more surly than you normally are, or quiet and more reserved, stayed away from people because you don't feel like talking. Poor school performance, same thing with adults. We can't perform well if we're not sleeping well. But in children, we see these kids they're bright children. There's nothing wrong with their learning ability. They just aren't able to learn because their brain is too sleepy. And that's a very big problem for children, especially for math and reading, two major subjects that they have to have for the basis of all their education. Violence. We've seen kids that are so overtired that they actually hit their siblings, they'll hit their mom or dad, slap grandma, throw the dog around. They act inappropriately and more violent way. And this could be an ADHD situation, but it's a very tenuous thing to try to figure out, why is this child acting out like that? Are they just so overtired they don't know how to relate that to you and they're acting out? And problem with making or keeping friends, we see this a lot because they are more irritable, or maybe more violent, or like that with their peers, or they have a hard time keeping friends a lot of times, or even making friends, because they're not usually very happy children, unfortunately. So signs and symptoms of a sleep disorder. And I want to tell you the first two are not only signs, but also can be consequences of not treating a sleep disorder. So it's hard to say, which came first, the chicken or the egg. So kids that seem depressed, a lot of times a sleep disorder can cause depression, or a lot of times kids just have depression. That's part of their makeup. But if you see an abnormal amount of anxiety, depression in your young child, that could be an indicator that something else is going on. If there's nothing else going on at school with their siblings, but they shouldn't be depressed at that age. Obesity, big problem in this country. We are a very, very heavy society. The southern part of our country is the hotbed of being overweight. Unfortunately, they have some great food down there, but it ends up putting a lot of weight on you. So we have to watch with our kids. That's a hard subject to broach with a child sometimes, taking away snacks or trying to keep their weight down. But if they have a tendency to put on weight, we know that we also put on weight in the neck, and the shorter the neck becomes, or the thicker, the harder it is to get air through there when it's crowded. Night terrors, sleepwalking, sleep talking. Night terrors, my sister used to have those. And what it is they wake up almost like they're awake. They sit bolt up in bed and they'll start screaming their head off. They're actually in the middle of a very bad nightmare, and it seems very real to them. And it's very hard to wake them up from this. The best thing you can do with night terrors is to just be soothing, hold them, try to get them to calm down. Obviously, sleepwalking is a very dangerous byproduct of, we call these a parasomnia. They're a different type of sleep disorder. But if your child sleepwalks, we've had children as they age, go off to college, walk off the balcony, do oddball things. So we have to keep an eye on them. Sleep talking, that just tells us you're not supposed to be able to talk in your sleep. That tells us that something is not correct in what the brain is doing while they're sleeping, that's allowing them to speak during sleep. Poor sleeping habits, allowing them to sleep maybe in mom and dad's bed, allowing them to, sleep on the floor, or things that don't promote good sleep hygiene. And we'll talk about that in a second. This is a big one: snoring, gasping, or pauses in breathing when your child's asleep. If you hear your child snoring or gasping for air, or if you hear them stop breathing, that's a huge warning sign that they probably have what's called obstructive sleep apnea. It means something is obstructing the airway. And with children, the easy fix for this is usually they have their adenoids and their tonsils removed, and it makes more room. Their problem is usually a little bit of overcrowding for an immature airway. And that's a lot of reasons why they get sleep apnea, is the overcrowding in the airway. But if any of those things are happening, that's an immediate red flag to give a call to your pediatrician or the healthcare worker that takes care of your child, to have a discussion that you've noticed this and keep a log of it. Teeth grinding. That's another thing that people do when they're overtired. It has a lot to do with the muscles in the jaw. So teeth grinding, and also I forgot to put in here bedwetting. Bedwetting is another consequence and sign that you may have a sleep disorder. Children a lot of times will sleep so deeply that they can't wake themselves up to get up to urinate. So holding back drinks and stuff like that is helpful. Frequent awakening, children should sleep in a block unless there's a lot of noise in the house and they can't adjust to that. But if they keep waking up during the night, that could be a cause for you to be alarmed that they may have a sleep disorder, because what happens is when oxygen levels plummet in your body, it wakes your brain up, and that might be what's happening, and that's why they're waking up. And sleepiness and falling asleep during the day, we've seen kids sleeping in class, on the bus, in all kinds of situations where they should be wide awake and acting like a child. So if you see your child, you're at a party and they want to go lay down somewhere, that if they're not sick, then that's an indicator that something's going on with their sleep that needs to be addressed. Now, what do you do if you suspect your child has a sleep disorder? Well, first thing I tell people before you go run off the dock is try to write down some of the sleep-related behaviors you've seen. I've heard him talk in his sleep, or I've seen her, she gets up and she's sleeping, she's sleepwalking, or she's very, she used to do well in school. Now all of a sudden she's not doing well anymore. We can't find what relation that has. Jot those things down. Then consult the physician that you see for your child, whether it's a pediatrician, a naturopath. Talk to them about what you've been observing and your concerns. And if warranted, your physician will send your child for an ear, nose, and throat consult, where they'll examine the throat and the nasal passages to see if there's crowding in there. Because as I said, with children, it's usually an easy fix. We go in and we take out the adenoids, we take out the tonsils, and now their airway becomes twice as big as it was before, and they're able to breathe normally. In some kids, it's not that, though. It's not the tonsils and adenoids. It may be something else. If you're really concerned and you want to talk to somebody that has a little bit of knowledge of what might happen if you do find out your child has a sleep disorder, you can always talk to a sleep lab that studies children's sleep. Not all sleep labs are experts in pediatric sleep. So make sure, usually the ones that are attached to a very big university in your area will have a pediatric sleep center, but they're not hard to find. You could always call, make an appointment to even go there and discuss some of these things. And also your insurance might need a referral from your primary care. So speak to your child's teacher and try to find out what's been going on in the classroom. Are they behaving? Are they sleeping? Are they participating? Even though your child might tell you they're doing the homework, if you don't check, are they really handing in homework? That's, how they're doing on tests. You should be aware of that already, but it's not a bad conversation to ask the teacher, because the teacher spends a lot of time with these children and may notice some subtle things that might put the puzzle together. And obviously, if you feel that there's something going on with your child's sleep that's not normal, you need to make an appointment to have them professionally evaluated. And normally it goes primary, and the primary will send the child to a pediatric sleep center where the child will have an evaluation and then eventually a sleep test. So so if you do find out your child has sleep apnea, what do you do? So not every kid that has a sleep disorder, not every kid will have these problems, but if they do, usually the number one is the surgery, tonsillectomy, adenoidectomy, and that usually solves their problem. CPAP therapy is the next in line, but as you can well imagine, if you know any adult with CPAP, it's very hard to get an adult to use it, never mind a pediatric patient. It requires a lot of diligence on the caregiver's part to make sure they put the mask on every night, that they understand how to use it, that they use it as frequently as you can get them to use it. So compliance with CPAP therapy and that particular age group is very difficult. Dental appliances, we don't see that as much until they get to maybe be in their teens because they do want to let their mouths develop. But if the child is a thumb sucker and there's some anomalies, they may require them to have a stopper or a blocker put in so they can't suck their thumb so they can start to fix their jaw. Weight reduction. If your child is obese, and you can find out from your pediatrician what obesity means for the size of your child, then you need to start considering how to get some weight reduction done. And that's a very difficult thing. We have a hard time as adults watching our weight, never mind trying to watch the weight of a child, trying to eliminate, sugary snacks, soda, things like that, that help the child put on weight quickly, would be helpful, because we know obesity, not only is it bad for your sleep, but it's bad for your health overall. And if you're a heavy child, it's usually very difficult. It's sometimes a lifelong process of trying to get that weight down. Adopting good sleep hygiene. I'm going to talk about that in a second. And good sleep hygiene basically means, and we talked about it for adults, is setting up a bedtime routine or the bedroom so that way it's amenable to sleep and not someplace that the child's going to go and want to play at that time or watch television. There should be none of that stuff in there. The next slide will tell us about some of the so sleep hygiene. The first thing you should do is keep a consistent bedtime. I know there are occasions when you can let your child stay up a little bit later, company comes, something like that. But as a routine, if you're putting your child to bed at 7 o'clock every night, make sure it's 7 o'clock every night and let them wake up on their own in the morning. Keeping a consistent bedtime, they'll start to get drowsy, hopefully, and prepare themselves knowing that 7 o'clock is coming and it's time to go to bed. Good sleep rituals: read a book, listen to music, give them a nice warm bath. Don't be doing, they're not supposed to be jumping on a trampoline, running through the house, because that's going to activate them again and you're trying to get them to calm down. So reading a book to them and making that your bedtime ritual every night so they kind of look forward to it. Okay, I know it's 7 o'clock. We're going to go up to the bedroom. Mom or dad's going to sit with me on the bed. They're going to read this book to me, my favorite book or whatever, and I'm going to get ready for sleep. It's just making a ritual out of it so that way they know what to expect night after night. They kind of like structure. No caffeine or sweet snacks in your bedtime. There's a lot of caffeine and things we don't even realize. Chocolate, sodas. These should all be eliminated, not only for the fact that they interrupt our sleep, but they also cause nocturnal endoresis, which means you have to go to the bathroom in the middle of the night. So for our children who are prone to bedwetting, we got to get those liquids away from them in caffeines, because it does stimulate the bladder. And we want to keep those sweet snacks down. If you're going to give the children anything in your bedtime, have it be something like maybe cheese and crackers or something mild that's not going to keep them awake. This is a tough one as the kids age. No electronics in the bedroom. We know that the blue light that's emanates from our computers and our cell phones causes our brain to wake up. It simulates daytime and keeps the brain activated. So with electronics in the bedroom, especially as they become teens and middle schoolers, they're listening for that next text or for the next thing to come across on Facebook or whatever platform they might be on so they can see what's going on. And that's going to keep them up all night. So take the electronics out of the bedroom. That should just be part of your bedtime ritual. They can have them back during the day. This is a tough one because I know when I was a kid, I was afraid of the dark. So trying to keep the bedroom as dark as possible. Remember, our body is wired to take cue from light to wake up. So if the bedroom is too bright, the child's going to have a hard time falling asleep and staying asleep. Because if they wake up in the middle of the night and the room is bright, they're gonna wake up. So this is a tough one. Try to do the best that you can. Keeping it dark. If they're afraid of the dark, try to use something like a night light, something very low light that's not aimed at them. Environmental sound machines are great if you live in an apartment building and there may be some noisy neighbors upstairs or to the sides of you, or if your children go to bed early in the summer and you have their windows open, you can hear people outside. So you might want to try to use an environmental sound machine. It may just sound like water or a car moving, and that constant noise will help them stay asleep. No scary movies or stories before bedtime. Remember, we as adults, we like horror and stuff like that, and we can usually tolerate that and fall asleep, but children can't. They have a hard time separating reality and fantasy. And a lot of times, as we joke about checking for monsters under the bed. This is going to keep them from being able to fall asleep, and it's going to keep them from staying in their own bed as well, because they're going to be frightened and be seeking you out during the night. So try to keep that kind of stuff away from your small ones. And also reassure your children that they're safe in their bedroom. Even if you have to do a little monster sweep, look in the closet, see there's nothing in there, look under the bed. A lot of times kids have things in their mind that we don't even know. And that's one of the, and they don't want to tell you because they're embarrassed or whatever. Find out what's going on. Why don't you want to stay in your own bed? It's not a great routine. I know when children are little, it's nice to have them in bed with you, but it's not a great routine for you or your children. Neither one of you can sleep efficiently when the child's in the bed. They're usually flailing all over the place, so it's hard to sleep with them, and it's not good for you as a couple with your spouse. So try to get them to stay in their own room and reassure them that they have the best bed in the house. So to summarize what we just talked about, remember, a child with a sleep disorder, they're not like adults. They don't even have an idea that they have a sleep disorder. They have no way to quantify their sleep. You and I can go back and say, oh my gosh, I had the worst night's sleep. I'm so tired. Kids don't know how they're supposed to feel. They just feel tired. You'll see them yawning, rubbing their eyes. A lot of these kids present with dark, dark circles under their eyes. You can spot them a mile away. A lot of times that's intertwined with an allergy patient as well. Why, we don't know. But like I said, it's incumbent on the caregiver to report the signs and symptoms to the child's doctor for evaluation, because the child's not going to be able to express what's actually going on. It's really important to treat especially obstructive sleep apnea where the airway closes off, because when the airway closes off, we get a drop in oxygen because we're not breathing. And this can cause metabolic, mental, and physical changes that have lifetime effect on your child. It could cause them to be less sharp, not be able to perform in school, not do well in sports, have more anxiety or depression. So it's very important to try to get a lock on what's going on if they're having problems sleeping. Like I said, it's very important to check this out, because their brain is just developing. And the last thing you want to do is mess with the chemistry of the body. And that's what the lack of sleep does. Anybody have any questions? It's kind of a heady subject, so.
Thank you, Laura. That was fantastic. Just really an unknown kind of thought process that we have to go through with our children, that especially that point that you made, it may be presenting as something completely different, like ADHD.
Right. I actually had a conversation with my children's pediatrician before we had some pediatric sleep labs in the state of Connecticut, and he was on CPAP, and I was telling him how children present. And I saw the light bulb go off on his head, and he was like, oh my gosh, I've been treating these kids for like ADHD and giving them Ritalin and drugs that they probably don't need if they were properly tested. So it was a real eye opener for him. So it has become, I know in the state of Connecticut, they did a huge symposium a few years ago and invited a lot of the pediatricians to listen to the board certified sleep physicians talk about things that they might want to look at, or that parents might present to them that might give them the idea, this might be a sleep disorder and not XYZ.
Yeah, fascinating. So thank you for that today. It doesn't look like we have any questions in the Q&A, Laura, so we'll look forward to next month. The next 2 months, we'll have an adjusted webinar schedule, so stay tuned for email on that. But again, thank you for joining. If you're joining us live, or if you've joined us on YouTube, thank you for joining us today. We appreciate having you. We'll see you next time.
Thank you. And feel free to send me any questions if you think of some. Have a great day, everybody.